In the early 2000s, as Bill Gates stepped back from his daily duties at Microsoft to focus on global philanthropy through the Bill and Melinda Gates Foundation, he turned his attention to some of the world's most pressing challenges, among them the devastating impact of infectious diseases in low-income countries. One such challenge was unfolding in a remote village in northern Kenya, where an outbreak of polio threatened to cripple an entire generation of children. Despite global vaccination efforts, the disease had found refuge in areas with poor healthcare infrastructure, limited access to medical supplies, and deep-rooted distrust of foreign aid. The village had no hospital, no running water, and only one small clinic that operated sporadically due to lack of funding and trained personnel. Parents feared letting their children play outside, knowing they could contract a virus that had long been eradicated in wealthier nations. Recognizing the urgency, the Gates Foundation launched a targeted campaign to vaccinate thousands of children across East Africa. But what set this effort apart wasn't just the logistics, it was the personal involvement of Bill Gates himself. He didn't simply fund the project from behind a desk in Seattle. He traveled to the region, walking through dusty streets, meeting families, and understanding firsthand the barriers that prevented life-saving vaccines from reaching those who needed them most. During one visit to a rural health center, Gates observed how outdated equipment, poor storage conditions, and a lack of education were preventing effective immunization. Rather than issue directives from above, he spent hours speaking with local nurses, volunteers, and community leaders to identify practical solutions. He returned to the U.S. with a new mission, not just to donate vaccines, but to revolutionize the way they were stored and distributed in extreme climates. Under his guidance, the foundation invested in solar-powered refrigerators designed specifically for use in off-grid locations. These devices allowed clinics to safely store vaccines without relying on unstable electricity networks. But Gates didn't stop there. He also supported training programs for local health workers, funded mobile clinics that reached even the most isolated communities, and worked closely with governments and NGOs to coordinate mass immunization campaigns. His team developed innovative tracking systems using satellite imagery and digital reporting tools to ensure no child was left behind. Over the next few years, the number of polio cases in the region dropped dramatically. By 2010, Kenya reported 0 new cases. The ripple effect extended beyond polio. Improved vaccine delivery systems helped combat measles, malaria, and other preventable illnesses. For the people of that small Kenyan village, the change was profound. Children who once lived in fear of paralysis began attending school regularly. Mothers stopped hiding their babies from the sun, afraid of exposing them to risk. And slowly, trust in modern medicine grew. What made this effort remarkable was not just the scale of the operation, but the mindset behind it. For Bill Gates, solving a problem meant more than writing a check. It meant diving into the details, understanding the obstacles, and finding ways to make systems work for the poorest and most vulnerable. Years later, during a speech at a global health summit, Gates reflected on these experiences. Technology alone doesn't save lives, access does. And making sure every child has access to basic healthcare is not just a moral obligation. It's a solvable problem. This story, like many others tied to the Gates Foundation, rarely made headlines. But for the villagers in northern Kenya, it became part of their history, a moment when one of the richest men in the world came to help not because it was profitable, but because it was right. And sometimes that's the greatest innovation of all, not in code or software, but in compassion.